As the rest of the country stays home and away from the danger, healthcare workers across this nation are risking their lives every day to fight this virus and save lives. But the virus is starting to take its toll on some hospitals, especially those without proper protective gear. At Belmont Health, Michigan's largest hospital network, 1,500 workers, including 500 nurses, are out of work specifically due to coronavirus symptoms. This as the state nears 19,000 confirmed cases and 845 deaths. I want to check back in with a nurse who works in the Beaumont Health System at Beaumont Hospital in Farmington Hills, Maureen Bittinger-Grisius. Maureen, when I read that 500 nurses from your hospital network are out, you were the first person I thought of. How are you?
Thank you so much. I'm doing well. I am healthy, tired. I'm very tired, but I'm doing well.
500 nurses are out sick. Do you and your colleagues have the gear you need to stay safe?
I think it's bigger than just PPE. You know, I really feel every day when I go to work that there are people who are working to make sure that we have enough PPE to go into rooms. But I think that a bigger problem is that there are so many people who are sick everywhere. You know, the numbers are just numbers, but they don't tell the whole story. Do I think that some of those nurses have gotten sick at work? Potentially, but it is absolutely impossible to say where any of us have come into contact with the coronavirus right now. It is so widespread in this area. It is in all of our communities, and it's everywhere. It's everywhere.
Do you think in your community there are many people who are home suffering, who haven't been tested, or who have been told, well, given your symptoms, you should just presume you have it? Do you think there's a lot of people suffering alone at home without care?
Absolutely. I really do. I know that we have such a limited ability to test on a widespread scale. And I think that really limits our ability to give accurate numbers or to know accurate numbers. I know that there are so many people right now who are potentially symptomatic and they are at home because, you know, that's what we're told. We're told to quarantine and to, you know, care for ourselves and protect other people so that we don't spread the virus. It's so hard to know how many people are sick right now.
Then do you think we should be caring for those people? Should we be testing those people? For you, a nurse in the richest country in the world, why do you think it is that we simply don't have enough testing cases, making it harder and harder to do your job?
I think these days I have more questions than answers in regards to a lot of those things. I think what some of the things that I worry about are, you know, without widespread testing, will this last 2 to 4 more weeks, 2 to 4 more months? You know, how long will this go on? How long can we ask people to continue to stay at home? I don't have an answer to that.
Since you're on the front lines every day, and you know so many of your colleagues who are around infected people are getting sick, does it concern you that so many people are talking about everyone going right back to work and exposing ourselves in the way that you and your colleagues are exposed?
Absolutely. I think that the future is really uncertain right now, and I don't know what that's going to look like, and I don't know what it should look like. I know that our healthcare system as a whole right now is under so much stress, and it's, when you talk about resources, it's bigger than just talking about PPE. It's bigger than just talking about ventilators. It's bigger than those concrete aspects of resources. One of the biggest resources that we feel is being stretched to the limit right now is people, nurses, physicians. The amount of people that are coming into our hospitals right now, we are taking the sickest of the sick, and we are asking those who don't need intensive hospitalized care to stay home and recover. And can we sustain another wave? Can we do this for an extended period of time? I think that is the biggest concern. When I look around and I look at my colleagues right now and I look at how many critically ill patients there are and how many nurses there are to care for those critically ill patients, it's not enough. We don't have enough. And I think more than figuring out who's right or who's wrong, what America needs to ask right now is how can we help? How can we share this burden? And how can we figure out moving forward how to proceed to keep each other safe and to keep our healthcare system and the physicians and the nurses who work in it afloat and healthy and continuing to be able to come to work every day.
Maureen, you're more than just doctors and nurses caring for patients all day. I know you've got 3 kids at home. How's your family doing?
They are okay. They are resilient. They are amazing. I couldn't ask for better kids. I couldn't ask for a more supportive husband, somebody who looks out for me when I want to keep plowing forward and keep trying to help everybody everywhere. So I have people who are helping me take care of myself, and we're all healthy. I have a lot to be grateful for today.
And again, Maureen, we're going to end it because you and I can't be crying on TV every week. I just want to say thank you. Thank you to your husband. Thank you to your kids. And thank you to everyone in your hospital system. I really appreciate it.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.